Coronavirus cases are surging in Africa, sparking growing concerns from public health experts. The continent has now reached more than 830,000 cases and 14,000 deaths. Last week, Dr. Mike Ryan, who leads the World Health Organization's emergencies program, warned that the continent was beginning to see indications of an acceleration in the infection rate of the region. All right, so we want to talk a little bit more about this. We want to bring in Ruth Maclean. Ruth, you are the West Africa Bureau Chief for the New York Times. So, it was sort of a slow acceleration, I think, on the continent of Africa. It seemed as if while Italy and other countries were dealing with this unbelievable pandemic, we weren't hearing a lot about the numbers coming out of Africa. And now things seem to be changing, and there is an accelerated pace. What can you tell us about what's happening on the continent in terms of the coronavirus and how things are changing rapidly?
Well, you're quite right that it took quite a lot longer here for the coronavirus to really take off or set in such a bad way as it did elsewhere. And now we're nearing the 1 million mark in terms of confirmed cases of coronavirus on the continent. Of course, that was reached a long time ago in many other continents. But here we are seeing a quite rapid acceleration now. I mean, for example, the first 100,000 confirmed cases took about 3 months to reach that figure, and the second 100,000 took only 19 days. So, I mean, it's normal. We've seen it elsewhere. It does speed up like that. I think, African countries, and we can't generalize about the whole continent. There's been a range of different approaches and different ways that the virus has spread in different countries. But, many countries did have a bit of a head start. There wasn't quite so much international travel coming in to the African continent as happened in many other places, in the States and in the UK, for example. So, governments locked down pretty early and stopped flights from coming in quite early. And so that really, I think, gave many countries across the continent a bit of a head start. But the thing was that, you can't maintain lockdown for very long, especially in a place where people really rely on being able to earn their daily living on a daily basis. It's just too tough for people to be asked to stay at home in many places across this continent. So a lot of governments then loosened restrictions. And I think it's partly in the wake of that we're now starting to see this acceleration.
Yeah, I think that's you make a couple of really interesting points. I remember early on in the pandemic days, the conversation about, people from Africa that may have been living in China, how to get them back very early on. A lot of countries started checking people's temperatures at the airports as soon as they arrived. They really sort of implemented measures rather quickly. And the other great point that you make is that as a massive continent, with the countries sort of have different levels of infrastructure, different levels of money dedicated to healthcare and public health. I want to ask you about Nigeria. It's the most populous country on the continent. It has not seen a tremendous spike in coronavirus cases. Its approach has been a little different than some of the other countries in Africa. What can you tell us about Nigeria?
Nigeria is an interesting case. I mean, as you say, there are so many people there. 200 million is a vague estimate, but really we don't know how many people there are in Nigeria. And, I think Nigeria had a great experience in the Ebola outbreak, in that they did have a case of Ebola that came in. This is back in 2014, I think, but they managed to trace him really quickly, and they really shut that outbreak down very effectively. And I think that Nigeria used a lot of that expertise when the coronavirus hit as well, and it was, I think, the first country in the continent to have a confirmed case of the coronavirus. So, they locked down pretty early, like many countries, but they did then relax restrictions fairly quickly too, after just a couple of months. And, I think many African governments would concur that it just isn't feasible to keep those restrictions in place for too long. But I think Nigeria particularly felt that, and I think in Nigeria it's quite difficult to really get a grasp of how widespread the outbreak of coronavirus is now. This is the case in many countries because there's limited access to testing. And that's for a number of reasons, one of which is it's hard for many countries to compete on the global market for the equipment that they need in order to carry out these tests. But I also think that in many parts of Nigeria, there is a reluctance from many people to approach hospitals or to report if they are having symptoms that seem to be coronavirus related. And I think there are a few things going on there. One of which is there are so many conspiracy theories and there's so much stigma attached to this virus that I think a lot of people, they don't want to be seen as a carrier of the virus. And it can lead to real ostracism in society. So, across northern Nigeria, we saw quite a lot of unexplained, mysterious deaths taking place a few months ago. Those seem to have died down a little bit more recently. But I think it's such a great example of how hard it is to grasp the situation. I mean, both in terms of the number of confirmed cases and how far that reflects reality and how many people really have it, and even in terms of the number of deaths, because often, people are not reported and people die and they're buried before they can be tested. So it can be really hard to know, how many people have actually died of this thing.
Yeah, it's funny because it's sort of the same, similar issues here in this country, in that because of the way coronavirus works, often, people become infected with the coronavirus, but they may sort of ultimately succumb to a stroke or something else because of the damage that the virus has done. And so even here, there are debates about, well, what is an official coronavirus? What does that mean on a death certificate? What are the actual numbers? Listen, very, very quickly before I let you go, this continent has dealt with an outbreak of illnesses. They're continuing to beat back malaria, tuberculosis, of course, HIV. How does the battle with coronavirus now impact the ongoing fights that they have with all these other diseases?
I mean, it totally disrupts it. And I think that's what we're seeing a lot of experts warning, that, and this is in Africa, but in the whole world, that services to try to combat TB, HIV, and malaria are really, really badly impacted. And, here where I'm in Senegal, in West Africa, and here we're just getting into malaria season, and, a lot of the normal programs that would have been carried out in terms of distributing bed nets to try to prevent mosquito bites and, spreading pesticides, a lot of that has not happened to the same extent that it usually would. And, I talked about Ebola earlier, and I think there are similarities, here too, where you have a disease that is scary and that you're trying to shut down, but then in doing so, you lose out to all these other diseases. And from what I've heard from many experts, both in the continent and in the wider world, we're talking about setbacks in fighting some of these diseases of years or even more, even decades in some cases. So it's really worrying.
Yeah, it certainly sounds like it. Ruth Maclean, thank you so much. Really appreciate your time.
Thank you.